Hi, I'm Dr. Jason Hochfelder. Today I want to talk to you about a great new technology that we're offering our patients here at Hudson Valley Bone and Joint Surgeons with regards to total knee replacement, which is one of the most common operations that we do and also one of the most successful operations that we perform. It's called patient-specific instrumentation. For short, we call it PSI. What that means is we actually are able to use a lot of new technology in order to plan the knee replacement operation even prior to the surgery. This allows us to place the implants a little bit more accurately and more precisely. A lot of research and a lot of studies have shown that knee replacements A, function better, and B, tend to last longer if they're placed a little bit more accurately. So what that involves is actually getting an MRI prior to the surgery. The MRI is usually not made for a diagnosis because we already know usually what the problem is, but it's actually used in order to get the information and actually a 3D model of the knee, which you can actually see here on the screen. This is an actual patient's 3D model that's been created from specialized software that we have. From this model, we can then actually pick out which sizes tend to fit the patient best and then actually plan out the positioning that we want to put them in. Just to give you an example here, for one of the components, the femoral component, which you can see over here on this knee model and over here on the screen, we can actually plan within half a degree over here. You can see we can make adjustments by about half a degree at a time in terms of how we want it to be rotated. And then we can actually decide which sizes fit best. You can see up here we can pick different sizes and see how those fit. You can see over here it'll change them, and it'll change and tell us how much bone we're going to take off or resect. And what this does is once we decide what we're going to do, and what we do is we base this not only on your bone and your specific anatomy, but also what your x-rays look like and also what your exam is like. And we take all of that information and come up with an exact plan. And then from this plan, once I finalize it, a 3D model of your knee is then created. I then use this 3D model at the time of surgery to attach temporarily to your knee, and then it acts as a guide and tells us where to cut the bone and where to put our implants, which allows us to do it much more accurately than when we've been able to do before. In terms of at the time of surgery, even though we have these as guides, of course we use our own experience, and sometimes we make adjustments at the time of surgery. So I think it's important to realize that there's really no substitute for experience when it comes to knee replacements, and that the most important thing that you're going to deal with is making sure that your surgeon has good experience and good results with their knee replacements. But this is one new technology that we now employ here at Hudson Valley Bone and Joint Surgeons just to take our patients to the next level and allow us to do our job even better than we were able to do it before.